Hello, everybody. Welcome to the IC Topic Chat for today. It is the middle of July. What is it, the 16th? Yeah, July 16th. So we're excited that you're here to join us. Jodie's going to be talking to us today about health insurance for consultants. Go
Hi,
ahead,
everybody.
Jodie.
So I want to give a caveat. I am a consultant, a program evaluation consultant. I am not a health insurance person. So this was kind of an interesting project for me to undertake because I had to learn a lot about health insurance really quickly. So I'm definitely not an expert in health insurance, nor can I offer advice in health insurance. But I was really curious to hear how consultants such as ourselves are getting our health insurance. And this really came about because I this year decided that I wanted to jump in with both feet in my consulting business and kind of do this full time. Um, but I wasn't sure where I was going to get insurance. And everybody I talked to was like, I don't know where to get insurance. So nobody had like a really concrete answer on where solo entrepreneurs get health insurance. So I developed a survey, and these are the results of the survey. Caveat again, 6 people completed the survey. So these are preliminary results based on what the 6 people have stated, with hopes that you all, after seeing this presentation, will complete the survey so we'll have even more data for future presentations. Um, okay, so the first question was, do you have any dependents you cover under your health insurance? Um, Whether that is health insurance that you are providing for yourself or health insurance that you are providing for your employees. And most people said no, they don't have dependents, that they're just seeking insurance for themselves. Of those who do have dependents, of the 16.7% who do have dependents, they have 3 to 4 dependents under their health plan. So do you currently have health insurance for yourself? 66.7% said yes, 16.7% said no. And of the 66.7 that said, yes, I have health insurance, 80% of them said they're getting their health insurance through a spouse or partner plan. Roughly what share of your personal income goes to healthcare per year? The vast majority, 50%, said between 8,000 and nearly 16,000 per year goes to healthcare, and that is personal income. So that's the income that you have to spend on your living, right? The income that you have to spend on rent and groceries and all of that stuff. So we are spending between 8,000 and $15,999 per year on healthcare. 50% of us. Overall, how satisfied are you with your health insurance costs? So this is a little more diverse. 33.3% said neutral. Um, and then 33.3% said dissatisfied. 16.7 said very dissatisfied, and only 16.7 said very satisfied. So that really tells me that we overall are not too happy with our insurance costs relative to benefits. Please rate the following plan in order of importance. So this is the monthly premium. So 4 people out of the 6 who responded, so 66.7%, said the monthly premium is the most important thing to consider when looking for a health insurance plan. 2 people said it's less important, but the vast majority, nearly 70%, said it is the most important thing. Uh, then again, 66.7% said deductibles and out-of-pocket maximums were the most important thing. So it's really telling the story that cost is the most important thing to consider when looking for health insurance or consultants like us. So what single feature would you most like to improve in your current plan? 60% of us said employee monthly premium. So whether that is the monthly premium that you pay for yourself, or whether that's the monthly premium that your employees, if you have employees, pay for themselves. Additional responses include plan network breadth and prescription drug coverage and, oh, sorry, deductibles and out-of-pocket maximum. So if we look at cost in general, 80% said cost is most important, which is interesting because this chart is saying that cost versus access to a larger network is equally important 33.3% of the time. Nobody responded. Keeping costs down is very important. They 33.3% did say it's more important, and 33.3% said it is moderately important. But it's just interesting that since cost came up so much throughout the rest of the survey, that nobody said it's very important to keep costs down. But then again, nobody also said it's very important to have access to a larger network. So that is the end of the presentation. So I wanted to kind of ask you all first if you have questions or reactions to this data. Did anything surprise you? Is this consistent with how you feel about your own health insurance situation?
And Jody, before we do that, why don't we just you and I have a little conversation before we stop the recording? And why don't you tell me a little bit about what started your path towards starting this survey, and what were your big questions?
Yeah, it was really selfish because I wanted to know how the heck do I get health insurance? I could not afford health insurance through Marketplace because despite its like advertising of being cheapish insurance, it was still too much for me. Um, and I couldn't afford to hire a um like like a sponsor, right? I couldn't afford to get like employer health insurance because I'm a solo entrepreneur. So selfishly, I really wanted to know what people were doing to get health insurance. So my number one research question was where are people finding health insurance and how much are they spending on healthcare costs?
And
So those were my kind of my most important questions as I went down this path of discovering these responses.
and you started this, what I'm trying to remember, was it back in like April?
Like
Maybe it was,
April.
yeah,
Yeah.
April. And so I know you probably had conversations with people, maybe whether they were formal or informal. You had conversations with people, you put out the survey. Tell me a little bit about just qualitatively, what did you find, and how did you end up resolving how to go about health insurance for yourself?
Yeah, so I talked informally with other consultants, some who are my mentors, some who I just know through this TIG, some who I know through other kind of consultants networks. And the vast majority of them said that they get health insurance through their spouse.
Mhm.
So I thought that was really interesting because my spouse was like, "No, I don't want you on my health insurance." Uh, so I don't know if I would increase his costs by being on his health insurance. I don't know how that works. Um, but like everybody I talked to qualitatively said that they get health insurance through their spouse, but it just doesn't, it just is a little interesting that like you have to rely on somebody else to get health insurance and health care if you are a solo entrepreneur. And just like this whole narrative, or maybe it's not a narrative like because it actually happens that you have to rely on your employer or your spouse's employer in order to receive healthcare access in the US. Now, this is different in Canada, I'm guessing. But in the US, it's just very interesting that you have to rely on your employer or your spouse's employer to be able to access healthcare. Um, so that's kind of like an interesting path, knowing that the the government is trying to get more people to start businesses and like really values like small businesses apparently. So with this like valuing of small businesses, but not really offering opportunities for small business owners or for solo entrepreneurs to have access to one of the most basic human essentials, healthcare, was just this interesting dichotomy to me.
Yeah, we could certainly get back into all the debates about whether we should have socialized healthcare, but I don't think that's going to be relevant because we're not going to be able to change it today. So how did you end up resolving this? Did you end up going on your spouse's health plan and costing him some more? Did you end up with your going through a broker? Did you end up going through your state's ACA? How did you end up? How did you figure this out?
Yeah, I convinced my spouse to let me on his plan, but I'm not yet on his plan because they require all kinds of paperwork for me to get on his plan. So it's not
Hmm.
just as simple as like me signing up. Like I had to submit paperwork saying that I lost health insurance through my old employer. Then I had to submit our marriage certificate. And it's just like every time I submit something, they come back and they're like, "Oh, we need another piece of documentation." So I am still uninsured. Um, but hopefully that will be rectified soon. It's just like jumping through hoops to try to get insurance as a solo entrepreneur.
Did you look at the cost difference between going through your state's ACA versus going on your spouse's plan, and how big of a difference was it?
It was double to go on my state's
Mhm.
health
That's what
plan.
I thought.
Yeah,
Yeah.
yeah.
And I think the reason for that, at least in my experience and my understanding, is you've got a group and the group brings down the costs, and then they end up looking at, relative costs for the people in the group over time. And, if you have a younger group that's uses less healthcare, the premiums are lower. But if you have perhaps an older population or people with more medical issues, it goes up. When I was at a small university, we had somebody who had a really terrible accident on a snow slope. And she ended up breaking her leg in multiple places, and they joked, and I think there might be some level of truth to it, that she raised everybody's premiums that year because of how serious her accident was. She was fine. She full recovery, and she's a faculty member at another institution now. But anyway, that's oftentimes why it's cheaper, because the group, you kind of um, get to lower your costs. If you have one person, the costs are higher because you're a one person risk versus risk spread out across a big group.
Right.
Okay, well, I think this was good, and I can't help but think that I'm just barely paying attention to the chat here. There's a lot going on here. I want to make sure we get to. But with that, why don't we pause here for the recording, and we'll get into some of the conversations that's happening in the chat, and we can talk some more out loud about that. And but if you're out there in YouTube land, we'll see you guys later. If you're here, stick around.